And I would like to welcome Chikeitha Owens. She is a licensed practitioner counselor who's also a certified bariatric counselor. So I'm super excited to have her on this series. And today we are going to talk about trauma and how it relates to obesity, because this is kind of your field. So welcome, Chikeitha. Thank you so much.
Thank you. Thank you so much for having me.
So I kind of want to start off and talk about how, like, you specialize in trauma and people who went through trauma. So let's kind of leave that out a little bit. Like, how did you get into that? And then we'll talk about how it relates to what you found obesity. So how did you get into this field?
So I started out some years back. I ended up working for Child Protective Services. And so I started out as an investigator. So I worked as an investigator for a few years, and then just working in that field, I got to see a lot of trauma taking place, you know, throughout foster care and working with children that have had, so many different types of abuse. So from there, I was still working on my degree, trying to finish my degree. And I ended up leaving in Child Protective Services because I was working at a substance abuse treatment facility. And there I needed to actually get my hours to finish my my graduation license. I was doing a lot. And even there, working in a substance abuse treatment facility, I saw more trauma. I got connected with more trauma. And then it was more like a combination of the Child Protective Services with the substance abuse. And that was one reason why I let the investigations position go, because I knew that it would be a conflict of interest, because a lot of those patients in the substance abuse also had a Child Protective Services case. And so that's kind of how I got started. And then I went out, opened up my own private practice. Still had a passion for foster care. So I got a contract with the state. Continuing to work with trauma, I no longer have a contract with the state right now, but I still kind of work a little bit with the children in foster care, and just the trauma.
Yeah. And so I think, and you can tell me what you've seen, because I started digging into trauma as it relates to other things relatively recent. I would say probably over the past year. And I have noticed that trauma that people experience as a child, as a teen, all the way through life affects them as adults and can manifest as medical problems. And so that's what interested me, because I noticed that a lot of patients with chronic conditions such as diabetes, obesity, substance abuse is one. A lot of these people, you can almost trace back trauma that they've experienced. And trauma can be a wide range, and you can probably educate me more on this. Like, trauma could be something like some of the more stuff that you were like abuse. I mean, that's like way up there, but trauma could also be experiencing some type of discrimination. Trauma could also be moving. It could be divorce. It could be. So tell me what you've seen as trauma and how it relates to manifesting in other ways.
I would say, and I'll just bring out the most recent thing that we have going on right now in society. We got COVID. That has been a traumatic event for the whole world.
Yeah.
We also have just the other week, or the last few months, we got the Roe versus Wade. So there's a lot of people experiencing trauma through that as well. And again, as you shared earlier, we got sexism, we got racism, we got so many different types of trauma that people are experiencing right now. But I think going back to the childhood trauma portion of it, you have a lot of adults, and I'm going to go with the adults. You have a lot of adults that experience childhood trauma. And I know that they have the ACEs assessment, the adverse childhood experiences, where you could actually take that to see, how much of a risk you are. And there are a lot of people that just kind of sweep it under the rug. You went through you saw the domestic violence. You saw, between domestic violence, a lot of times I like to always just share that it doesn't just have to be, the husband abusing the wife. That's a lot of times when we hear domestic violence, that's what we think. but it could be so much more. As in when I was doing the working with CPS, you see the children getting abused. That's domestic violence as well, because it happened under their roof.
Yeah.
So it doesn't
Or them seeing it, right? Them watching
they
it.
seeing
Yeah.
it? Yeah. So even growing up in a more empowered neighborhood and seeing things happen on the street, a lot of children that grow up in the lower socioeconomic neighborhoods see these things daily on the street. I'm one of them. I grew up in an area where it was a lot of stuff going on, a lot of stuff that, you know, as a child, you know, that was witnessed. You know, you get to see so much, but you know, as a child, you don't really think. You just look at that stuff and think it's normal because you see these people just got problems and they walk in the streets and doing whatever they do. But when children start witnessing people getting killed, you know, in this day and time, children are witnessing these type of things.
Yeah,
And
the shootings, the school shootings. That's another huge trauma that happened recently.
Yes.
Yeah.
So they are witnessing so much more. There's a lot of sexual abuse that these children experience. That's
yeah, I know. I agree. That's one of the biggest things that I've noticed in my patient population. A lot of them have undergone sexual abuse. And so what are you seeing is the connection between trauma and then how it manifests as people get older?
I think that it's one of those situations where nobody's doing anything about it. Nobody's talking about it. And as people get older and start digging, because it's really not until they start digging, or if they start having what we call with PTSD, when they start having the reoccurring flashbacks, until, you know, they realize that they got to do something about it. And sometimes, you know, you hear a lot of people say, well, you know, I thought I got over this. I never knew that this was a problem. You know, I never knew until I started having nightmares. I never knew until, you know, a particular situation happened that triggered all of these emotions. And so I think that as people get older, they start realizing like, wow, that really did affect me. And as they move forward and really start doing things about it, you know, as it pertains to being overweight and with the whole obesity portion of it, you hear so many people eating emotionally, not understanding why, you know, why is food my comfort? Like why I feel like I don't have any other place to go because they don't have the coping skills in place. And so they get connected with the food. And another thing I will tell you that I've noticed is that there are a lot of people that went through, you know, we talk about the lower socioeconomic, that didn't have enough food growing up. And so as a lot of these children with the Child Protective Services go into care, a lot of the things that I noticed that we would see is children hoarding food. Like they would have food in their drawers, like they would hide food in their coat pockets, like they were hiding food. And so you just think about that as them growing older into an adult and having that desire to want to do that. Do
they overeat in those situations? Are those patients say that was deprived in like younger years? Do you see them? Is that manifest perhaps as overeating maybe?
I think that it could be. I think it just depends on the child. Have some that do overeat. Just from working in that field, I did hear a lot of complaints from foster parents having to put rules and literally put rules on the refrigerator. Like you don't get anything out the refrigerator unless you ask. So I did see a lot of them having to start putting stipulations on snacks, stipulations on, you know, just when it came to food, just because some of them were out of control when it came down to that.
Yeah, and then that all manifested from what they experienced when they were a child. So when I first met you, one of the things we talked about is how you saw the connection. One of the things that like why you just had this desire to go into bariatric, specifically counseling, is because you saw this connection between trauma and a lot of what's going on in bariatric patients. So can you kind of like educate us on what you've seen and more about that connection of what you've experienced with just the trauma patients, and how is that connected to bariatric patients? That's the first question. And then I'll have a follow-up question.
Okay, awesome. So I'll just share that one of the things that I have seen through research and, just trying to connect the trauma with the bariatrics, because a lot of individuals, as we were stating earlier, that there's so many different types of trauma. And you see individuals that share that they have been abused. You see individuals sharing that they were bullied because of their weight. You see individuals even being bullied when they go to the doctor's office and feeling like the doctors don't even understand or are not even sensitive to the weight issues that they're having. But piecing it all together, if you were to go back and probably read those individuals' assessment and their history, most likely they had some type of trauma growing up that pretty much that they haven't had an opportunity to heal from. And yeah, again, it keeps taking me back to that whole emotional eating part, like they just want to almost, and I hate to say it, but almost thinking that the eating, because it's a comfort place for them. And I think, one of the things that I teach in my therapy is let's find a safe place. Let's find for my children that I work with, I tell them, let's find our happy place.
Yeah.
So I think for a lot of these individuals that are going through this, they're seeking that happy place. They're looking for that comfort level. They're seeking that place where they just want to feel safe. And sometimes it could also be them feeding into trying to make that inner child feel safe. That child that's still growing up in there, that experienced all that trauma, that still has not had an opportunity to heal. And I've heard a lot of people that almost feel like that because they didn't protect that child. Then now that they're older, they got to protect that inner child.
Yeah, that makes sense. That makes a lot of sense. And so I guess the next question would be, is it always emotional eating for the most part, or could it manifest in some other way? Just out of curiosity.
Definitely. I think that, I believe that ultimately it may end up with emotional eating, but not just necessarily the eating portion of it. You see some people that turn to drugs as well. And even one of the things that I've seen that after, and you may have heard this as well, a lot of times after people have the bariatric surgery, they go back and they find a whole nother addiction, which is now it's not food, but now it's alcohol, or now it's drugs. And we know with alcohol, that alcohol is pretty much, a sugar in itself. And if individuals were addicted to sugar before, and now they are, substituting with alcohol, then that could cause and bring in a whole nother problem as well. But I think that, to your question, definitely, I think there could be other ways that they can soothe themselves outside of emotional eating. But I think even if they, substitute something else, it's going to still almost give them that same result.
Yeah, correct. So essentially in cases like that, it may not be emotional eating, but like you said, it could be maybe alcohol. I've seen sex. It could be drugs, some other way to kind of soothe, to make themselves feel better, to find that comfort, because they haven't really dealt with some of the trauma from their past. So in a situation like that with, say, one of my patients, how would you find that trauma? Say if they're completely unaware, but clearly they've had something, but they're almost either unaware or they're in denial. What are some of the things to be done to kind of help bring about that awareness, would you say?
I think the first thing would be is to look at their background and see if they've had any of those experiences. If they're willing to open up and share about those experiences, then we can talk a little bit more about those childhood experiences. See if they've had any triggers to come up recently, things that they've been able to identify with, where they can see that it brought back those memories. And then we can look at one thing that I teach is the cognitive behavioral triangle, where we look at our thoughts, our feelings, and our behaviors. And so we look at, when you think a certain thing, if that thing is positive, then most likely you're going to have a positive emotion, which in turn, you're going to have a positive action or a behavior. But if it's a negative thought, so let's just say that negative thought was part of that trauma, that's going to come with a negative feeling. So guess what? Now we got a negative behavior, which that negative behavior could fall into our emotional eating pattern that we were talking about. That negative behavior could fall into, okay, now I'm using drugs or drinking alcohol or being promiscuous or whatever that looks like. You'll see the pattern with that cognitive behavior triangle, because there's always going to be a behavior connected to a thought process and a feeling.
Okay, that makes sense. I talk a lot about that kind of in my programs, like neuroswitch, like the mind and how that directly affects our behavior, like 100%. So you're saying, and a lot of us are familiar with some type of CBT therapy, but
yes,
you're saying like essentially that negative thought eventually can bring about a negative action. I say that all the time. And so I wonder if you can kind of expand on that and help educate others on how that works, or maybe give like more of an example on how that works.
Sure. So an example that I can give, so let's just use an example of a child that experienced sexual abuse. And one thing that you may see sometimes in adulthood with an adult that may have experienced sexual abuse, they have sometimes may have a very hard time with being intimate with their spouses because those relationships may be a trigger.
Yeah.
Maybe a trigger, even just bringing back memories of going through that. And so in a situation like that, look at our thought process, that thought pattern may again take us back to our past of when it occurred. So what we want to do is we want to find something positive. We want to find a positive thought that we can replace that with. So rather than thinking about it and going back to the past with it, how can we think about it in the present? How can we be in the here and now? And that's another thing that I use a lot is mindfulness. How can we be in the here and now and think about what we have in this moment? Okay, I have a loving husband. I have someone who cares about me. I have someone who supports me. Like this is not the person that hurt me. My husband is only here to comfort me and love on me. So if you got to create a lot of affirmations or whatever you got to do in that moment to help you change that thought process, then that's what you do. And then that in turn is going to change those feelings. Those feelings may no longer be feelings of feeling scared or, whatever emotional connections that was connected to that past trauma. And so now our behaviors are going to look different. So it may bring us to want to be more intimate with our spouse. It may bring us to want to spend more cuddling time with him, and not to say the flashbacks won't come, but when those flashbacks come, then that's where you have to start with the coping mechanisms and start with the positive affirmations and changing that thought process.
Okay. And so would you say, because that's just what I say, I think it starts with the thought. And so one of the things that you kind of teach is it starts with your thoughts. So I love the fact that you brought in positive affirmations. And so to kind of almost switch that thinking around, but that's not, I wouldn't say that's like intuitive for most people. That's hard for a lot of people.
It is, yes.
So how do you recommend people start with when they have a negative thought? Because it's about everything. Everybody, I think, automatically thinks in the negative for whatever reason, right? About everything. They always think I can't. So if you give them, oh, I can't work out. Oh, I can't eat healthy. Like, how do you automatically almost like stop those negative thoughts and have them switch to start being more in the positive in order for their actions to become more positive?
One thing that I share that I love, and it's been helpful, is to utilize your phone. I mean, that's one thing that most people keep right next to them. And so using your calendar, you can, before putting it on your calendar, you can write it down on paper and just write out those affirmations that we were just sharing, or whichever ones you want to create for yourself, for whatever area that's in. You write those affirmations down and you put them in your phone. I have them in my phone. They go off all day long. I have them starting at 8 o'clock in the morning, 10 o'clock, 12 o'clock. And depending on where you are spiritually, you can put scriptures in there. for me, I do a little bit of both. I mix mine up with scripture. I mix it up with the affirmation, and it's just going off all day. And I can just glance all over there and watch and see. I mean, at this point, I automatically already know what it is. Glance over and I can look and see. And for me, it's a reminder. It's a reminder. And I think a lot of times we don't push forward in what it is that we have to do because we're so forgetful, because we're doing so much in life, you know, with kids and work and everything. Sometimes you just forget. It's not that you really just tired and don't want to do it. A lot of times we have the desire to do things, but before you know it, okay, you got to pick the kids up from school. You got to go do this. And now it's just slipped right on. Oh, I was supposed to go to the gym.
Yeah.
So just being able to have something as a reminder to remind you of your goals and those things that you have to do. That's something that I think that may triumph just about all of it. That way you can remain, that'll keep you in the here and now.
Yeah, that for sure. So do you have them set up as a time, like 8 o'clock, it's this affirmation, 10 o'clock, it's this scripture? Do you have it set up like that?
Yeah, I just let them choose what they think would work best for them. Choose. But I think the very first one needs to be something very encouraging and motivational. Like, for instance, for me, my 8 o'clock says, you are beautiful, you're fearfully, you're wonderfully made.
Yeah.
And that's all I need to hear. And then after that.
That's a scripture.
It's a scripture.
Yeah.
And it just goes on with the flow of, you know, do your best today, be kind to others, just all of those things that I feel are going to help my day go good.
Yeah. Yeah.
So that one pops up at 8 o'clock every morning.
Yeah. Okay. Yeah.
So for me, it's just a reminder, because I feel like if you continue to remind yourself, then you'll be more apt to go through with it and do it and think positive and stay in that positive mindset.
Yeah, I agree for sure. Positive mindset is definitely the route that I think everybody should go. I guess my next question is so if I'm like a provider and I want to kind of start, if I even want to know if somebody has gone through trauma, that's not typically something that many people ask, even counselors per se. I don't know if that's kind of their first go-to. How do you kind of start the conversation? And like for me, like that's not something that I would per se treat, but I think it's important that I'm at least aware of it. You know what I'm saying? And I think it's important that patients and providers alike should be aware of it, even if it's not something that they can treat. And then obviously go see someone like you who can really kind of dig deeper and help them through that. So what would you say for somebody who's like me, or just a patient who's like, where do we even start? Like, what questions do I ask? How do I would start when I see a patient?
Okay. So I would just say, because I would say for me, it just kind of comes natural just because I work with trauma.
Yeah, correct.
Part of all of my assessments, just about like that is just
part of the ACEs, that as part of your, yes. I mean, that's not specialty.
Yeah, not necessarily the ACEs, like that's optional, but when I'm doing my initial intake, in my questioning, even on my questionnaire for my intake, like there are questions in there. Have you experienced past trauma? Have you experienced sexual abuse? Like that's just in there for them to check. So then if they check yes, like they may not go into detail, but as we get into that session, I can ask. So I see you checked here that you experienced some past trauma. Would you like to share more about that?
Okay.
And then they may go into detail if they feel comfortable sharing. They may share a little bit more with you. And then from there, you can, as you're documenting, if you feel like, you need more information, you just ask wherever you feel comfortable, and the patient most likely will share. And that will give you a better idea if you're working with a patient that has past trauma. Now, once you get that information, now, okay, what do you do with it? Like, this is not my specialty. So what do I do with this?
Right.
I would tell you to get in connection with some psychiatrists, get in connection with some psychologists and some counselors, even licensed clinical social workers. Anyone in those fields pretty much work with individuals that are dealing with mental health issues. But if you need more of a specialty, like if you want to find somebody that specializes in CBT or mindfulness, then you would just search there as well. And depending on, then you got to look at what insurance they have and all of that as well.
Yeah, correct. So I think and you can confirm or not confirm, I think that's a good start for somebody who's not a psychologist or psychiatrist or a counselor, at least to ask, hey, have you had any past traumas? And at least the surface, because at least that initial knowledge, I think, helps you put in a better position to understand the patient. I think right now as a doc, we only ask past medical history, basic, like, past surgical history. And I really do think we need to expand kind of our offerings, at least so we can better understand our patient, because that way we can at least identify, especially in the bariatric and obesity realm. Like, I think being able to identify this up front is going to be very helpful for not only a partnership with someone like you to help push this patient along. I think big picture, the patient will do better. I think just giving them a surgery is not enough, because as we talked about, after surgery, if they haven't dealt with those hurts or those traumas, which is what I was seeing in my practice, then they just go back to those. It keeps coming back. Like, the surgery itself doesn't change that hurt or that trauma. The medication we prescribe doesn't change that hurt or that trauma. And a lot of times bariatric surgeons don't even know it exists, because we don't ever ask. Honestly, like, that's not even on my initial assessment. I'm going to add that, but it's not on my initial assessment. For me, I'm just so close to my patients, like, they just tell me everything, but that's not even a part of it. I think I 100% agree that should be a question that we ask, since there's such a high correlation between obesity and any type of addictive behavior and trauma, you know what I'm saying? And then be able to get them the help that they need, because I will say they 100%, I think, once it's identified, need both. Yeah.
Yes. And I would also just say, I also have medical on my intake. And because I think that it's so important, especially if I have someone, even with depression, as we know that individuals that have thyroid issues, depression is one of the symptoms.
Correct.
I always, if I see that individuals or even have any slight of medical issues, I always want to make sure I'm recommending for them to check out with their primary care physician as well, because we don't want to just assume that all of this is just coming out of nowhere, because it could be a medical issue that's leading up to the depression. And I think, all of that just go hand in hand with the obesity as well, because it could be, again, like we've been talking about, it could be some of these childhood trauma issues that are leading up to being obese, to the obesity. And the more and more that I research about it, it basically just shows that, when the children experience the childhood trauma, like the whole process that takes place in the brain and the age they're at, the maturity where they're at. And I know sometimes you hear a lot of people, over the years, I've heard people say, for children that are adults now, but still act like children. A lot of times you hear people say they're stuck in that stage because, they were abused when they were 6 or 7. So now it's like their mindset is stuck in their stage, even though they're 30.
Yeah, correct.
So I've heard people say that, but I never understood what that meant, until I really, really started learning more and more about childhood trauma and how it connects all the things that happen in the brain during that time that could affect them in their adult years. And so, but yeah, I would just say do more research in that area so you can have a better understanding of the trauma and how it affects the medical part of it. Because it definitely does.
I agree. And you're right. I talk about neuroscience and brain science and how all of that affects. And so that's one of the things and why I wanted to have this conversation, because I just want to make it clear that we can't leave that on the table. Like, patients should be aware that this is affecting them. Providers should be aware that it's affecting their patient. And we all should start forming partnerships to be able to treat the whole patient holistic. Yes. Very much like you were saying, like, you look at the medical just to make sure, that the mental health part is not related to medical. I think we should also be looking at the mental health part to make sure that's not affecting the medical. I think it goes hand in hand. And if there is some type of crossover, then we need to start bringing in partners in so we can holistically help and treat the patient. So
Yes, that's beautiful. Well said.
yeah, thank you. Well, thank you so much for being for talking to me today and educating not only myself but our audience on trauma and how it relates to chronic conditions such as obesity. I just wanted to make sure and bring about an awareness about this, and that there was people like you that could be able to help, and that we as providers should partner with you guys, and even patients who are watching this, who now have an awareness that something they may have experienced as a childhood. If you're struggling with weight loss, or if there's an area in your medical journey that you're struggling with, you definitely should consider seeing a mental health counselor to help you get through that, to help you get over that. So thank you so much for talking with me today.
You're so welcome. Thank you for having me.